Good evening, one and all. Welcome to the webinar on career opportunities in public health. Requesting our panel members, Dr. Sarala, Dr. Sudeep Shetty, Dr. Sumanth, and Mr. Guru Prasad to enable their video, and let's begin the program.
Thank you, Dr. Deepashri.
Thank you, sir. First of all, I'm Dr. Deepashri, working as an assistant professor at IIHMR Bangalore. I have been completed my graduate in Ayurveda and also the Masters in Public Health from IIHMR Bangalore from the batch 2011-13. Currently pursuing my PhD in Public Health Communications, and it's my privilege to welcome you all and introduce my college, that's Institute of Health Management Research, Bangalore, South Campus of IIHMR University. Next slide, team. Lambodar requesting, yes, thanks Lambodar. IIHMR Bangalore was established in the year 2004 and itself is a unique research, education and training center in the sector of healthcare. Way back our university started in the year 1984 and the South Campus we started in the year 2004. Bangalore flagship program, that's post-graduation diploma in healthcare management, was approved, receives AICTE approval in the year 2010. And in the year 2015, we have received the NABET accreditations as a consultancy organization for NABH. 2017 marks a new landmark for us, where we started a new specialization on healthcare information technology management. And 2018 was a celebratory year for us because we were granted with the MBA equivalence by the Association of Indian Universities and also the MBA accreditations. In the year 2020, we have expanded our flagship program and introduced a new specialization known as pharmaceutical management. And also we have increased the size of the batch size from 60 to 120. Next slide, Varkis. We have four specialization. IIHMR works in the four key verticals, which is academics, research and publications, training that we call as learning and development, and also the consultancy. Under academics, as I said earlier, we have a flagship program known as post-graduation diploma in healthcare management with specialization in hospital management, health IT management, pharmaceutical management, we offer the seat of 120. We have an excellent placement record, and it's proud for us to say that we finished our placements in 2 months in the past year. Under research and publications, we do take up projects like evaluation, formative, implementation research, social assessments. Under the thematic area, RMNCH, life course health, non-communicable diseases, health communications, and digital health. Under all the geographical areas like urban, rural, and tribal. Under learning and development, we take up several programs, which is management development programs, faculty development programs, executive development programs, and also certificate programs with the renowned universities. We also take up students engagement programs, webinar series to help bridge the gap between the knowledge and practice. We are equipped to take up in-person, virtual, or a hybrid mode of programs. Under consultancy, IIHMR Bangalore faculties and has an institute take up consultancy projects, and under the thrust area, NABH, quality management, growth and strategy, and project impactment assessments. Next slide, Varghese. Coming to awards and recognitions, in the year 2017-18, we were awarded as the top hospital management college by the Higher Education Review magazine. We also received Educational Institute with the best academic interface and academic and industry interface by World Education Congress in the year 2020. We are the top 11 and top 10 ranked schools under the week and the outlooks in Bangalore. and also received a best business school in the India for the year 2021 by the Knowledge Review magazines. Next slide, Verghese. Coming to accreditations and empanelments, we have been, as I mentioned earlier, our postgraduate program in hospital and healthcare management is approved by All India Council of Technical Education, that's AICTE, and accredited by the National Board of Accreditations. We also work as a consultancy organization for NABH by the National Accreditation Board for Education and Training under QCI. Our program has been awarded MBA equivalents by the Association of Indian Universities, and also we have registered under national institutional rankings. Next slide, Verghese. Next slide. We also have been empaneled with national and state level government organizations. Under Jal Jeevan missions, we act as a key resource center for training for the L3 level. We also have been empaneled with NHSRC for implementation research for health system strengthening, empaneled with National Health Authority for facility assessment of healthcare entities for state health authorities under AB PMJY, and also we have been empaneled with Karnataka Evaluation Authority for M&E projects. Now, coming to the most interesting topic of today's webinar, that's the career in public health. Most of us understand that this public health is an ever-growing and evergreen sector of healthcare. With our panel members, today we'll learn how and what are the opportunities we can look for, and what are the skills we should require to get into public health and to excel in that. Next slide, Verghese. Today we have with us Dr. Sudeep Shetty, Senior Health Consultant, Unicef. Dr. Sudeep Shetty is a senior health and academic and research professionals in Unicef with university degree in MBBS and advanced degree in Masters of Public Health, with a blend of professional experience of 2 decades of from grassroots primary care through state and national techno-managerial roles in health systems in Indian context. Proficient in medium or to large-scale project management, use of result-based management techniques as prescribed by UN nations. As an academician and healthcare researcher, founded and headed School of Public Health and Department of Health Systems Management and Hospital Administration in K.S. Hegde Medical Academy, Nitte University, which is the leading health academy in South India. Welcome to you, sir, and it would be privileged for us to listen to you.
Thank you so much, Dr. Deepashri, for this introduction. Yeah.
Thank you, sir. Next slide, Verghese. We have with us Dr. Sumanth, Assistant Professor, Department of Community Medicine from Mysore Medical College and Research Institute. Dr. Sumanth has completed his MBBS from Mysore Medical College and MD in Community Medicine from JIPMER. He has worked as a junior and senior resident at JIPMER for 4 years and currently working as assistant professor at Mysore Medical College. His research areas of interest is diabetes, hypertension, road traffic accident, self-harm, health system strengthening, and medical education. He has published around 45 publications under his name in national and international journals. He has also written chapters in Textbook of Community Medicines by IAPSM and chapter in Target JIPMER PG entrance book. Currently involved in projects like self-harm preventions, that is SASHI, and also improving the capacity of health system and community for screening and management of non-communicable diseases among scheduled tribes, and implementation research in Chamarajnagar, Karnataka, phase 2. Welcome to you, sir, and honored to listen to you today.
Thank you, Dr. Deepashri.
Next slide, Verghese. I would be very happy to introduce Mr. Guru Prasad Swami, my senior at IIHMR Bangalore and alumni of IIHMR Bangalore. Mr. Guru Prasad has completed his BSc Nursing from KIMS Hubballi and PGDHM from IIHMR Bangalore. He has also completed his diploma in health promotion from NIHFW New Delhi. He has worked as a junior program manager at Directorate of Health and Family Welfare Services, Bangalore, and currently working as a district consultant fluorosis at District Health and Family Welfare, Raichur. His research areas is anemia during pregnancy and non-communicable diseases. Currently involved in implementation of national program for prevention and control of fluorosis in Raichur, the district of Karnataka. Welcome to you, sir.
Thank you, Deepashri.
And I would like to introduce the moderator for today, Dr. Sarala R., Associate Professor and Associate Dean, Research and Publications, IIHMR, Bangalore. Dr. Sarala is a social scientist with PhD in sociology from the Institute of Social and Economic Change, Bangalore, one of the renowned institutes of social science in India. She is a recipient of research fellowship from Indian Council for Social Science Research for pursuing PhD, and she's also passed the NET for the lectureship in sociology conducted by UGC New Delhi. She has more than 10 years of experience in teaching in the field of health policy, healthcare delivery system, research methodology, health systems research, and human resource management. She's been involved and working as a PI and team member in various projects funded by national and international organizations such as ICMR, Unicef, Alive and Thrive, United Way, and HCL Foundation. Welcome to you, ma'am.
Thank you, Deepa.
Thank you. And last slide, Varghese. Thank you once again to all of the participants who have joined today. Not taking much of your time, and let's dig into the panel discussion. Over to you, ma'am.
Thank you, Dr. Deepa. To start with, I first welcome all the panel members here, Dr. Sudeep Shetty, Dr. Sumanth, and Mr. Guru Prasad. I'm very happy to have you all here for this evening to discuss about what is the career growth in public health. Let us start with the question with Dr. Sudeep Shetty. Sir, you've been working in the public health for long, and we would like to know, like, according to you, what is public health? This is a very important thing because people are always confused what is public health, how it is different from the hospital management or other coursework, and whether it is restricted only to national health programs or beyond. And do you think public health management is the cornerstone for health system strengthening? So can you please mute yourself?
Yeah, I'm sorry. We keep muting, unmuting videos and audios in between. So, yeah. So, good evening, everyone. Dr. Sarala for this moderation, Dr. Sumanth and Mr. Guru Prasad for being my colleagues for today's event, and Dr. Deepashri for your wonderful introduction and, coordinating this activity for this audience, and your support staff as well. And first of all, the audience were primarily potentially the students or aspirants in public health. I'm not sure about it. I think I understand it. That is a profile of it. Yeah, the question asked by Dr. Sarala is a bit complicated for a person like me because I am more into programs, not much into academics at present. But somebody is asking me to define a public health. Somebody. Everyone required to see the dictionary or textbooks of public health or something like that by heart. But I don't know how to define it. But I can put my definition. Like, definitions are usually wordy, flowery if you see the textbooks or dictionaries. But public health, as I define, it is like broadly, I would say, it is like, it is a discipline that addresses health at population level. That is a summary of it. No more, no less. That's the definition. Now you can add upon whatever is required, depending on the requirement. For example, as I said, public health is very broad term. I think it is a bit different from community medicine as such. I think Dr. Sumanth, who is expert in community medicine, also knows it. But it is a bit broader. So the definition is just that, anything, the discipline that addresses health at the population level. So if you understand what public health professionals do, that it is also a bit complicated to explain because they work in diverse professions. and diverse career streams actually. So if you understand that, I think it is easy to understand. For example, a public health professional usually does two major thematic areas. One is understanding something, and second one is acting on something. So if I categorize these two, understanding and acting, understanding is like what is happening at the population level in terms of health. It can be health care of the normal people or health care for the sick or diseased people. These are the two categories where public health system works. And when we say about understanding public health, it is primarily through surveys or surveillance system, or through the research activities or research studies what we do. And this is primarily research and surveillance is primarily to assess the exposure to a risk factor and see the outcome, what is happening in terms of disease or disabilities, whatever. So this is primarily to understand the magnitude of a health issue, or also to understand the distribution of health issues. It can be on the risk factors or the disease. And it can be at any level. It can be for a small district or a state or a country, or as we talk about global health as a whole. So it is a very broad term, as I understand. That's what I define. But if you keep the question Dr. Sarla was asking, like how it is different from NHP, I consider NHP is a small component. National Health Policy 2017, what India has brought out, it's a component within the public health. It's a broad domain. In fact, public health was a term which never heard since last 1 decade back, if you go back. Because when, for example, if you ask my career growth, I pursued public health post-graduation almost close to 2 decades back. So when I did my master's in public health, people were asking, what is his degree? What is public health? In fact, even the Directorate of Health officials at the state level and national level, they used to say, what is this degree? We don't entertain it. But that took, particularly after COVID pandemic now, even a rickshawala knows what is public health, what is pandemic, what is quarantine. That is a level of awareness what even the common people are understanding in terms of public health. But of course, it's a very broad term. And of course, as I said, it is different from NHP. NHP is a policy to transform the healthcare or to enhance the health of the population within this country in next 5 to 10 years. But I would say public health covers everything. It is primarily, as I said, it is primarily in understanding certain things and acting. Understanding is through surveillance and some researches, and acting through the program management. And your third question, component was on primarily on whether public health management is a cornerstone in public health system strengthening. When you ask this question of health system, it is also very broad term. As you see the WHO definitions, if you look into that, you will understand there are major 6 building blocks of public health. Like leadership and governance, which is on the topmost. If you consider, that is a major building block. If they decide, then the system will run. And service delivery, how the healthcare services are being delivered to the community or the population, that is another part. Financing, without money, we can't do anything. That is another part of it. And the medical supplies, vaccines, devices, technologies, without this, healthcare will not, it cannot be addressed as we think of. And health workforce, which is very important in terms of the number of doctors, nurses, whatever, the different streams of healthcare providers. That is another group of health system building block. And finally, the information system, the technology, whatever we have, the digital technology, which helps in management system, information system, that is helping public health. But public health is not just curing. When we talk about individual care, it is a doctors, nurses, physiotherapists, or an optometrist job. But when we talk about public health, it is more of social determinants. It is more of social science rather than medical science. But it is a congregation of these two. But I would consider, Of course, public health management is a primary thing, because management comes every level, starting from the evolving the policies, or advocacy, program development, program execution, monitoring and evaluation, and this cycle. The whole cycle involves the management. So that is how it is. It is it's a very broad term, and primarily addresses the health of the population at population level, not at a facility level. Yeah.
Thank you, sir. You have explained very well that public health is working with the community, understanding the community, and acting upon the communities, especially the people with the normal as well as people with sick people. I think that was a great one. And also, you have brought a very good idea that when I asked about the public health management, is it a cornerstone of health system strengthening? In fact, WHO says that 5 components. We are talking about the building blocks. I think that shows that our students who are completing the public health management, they can be in a leadership role, or they can be in a contributing the financial part of it, or in terms of supply chain, or in terms of building the information system, or HR. They can play a vital role in terms of health system strengthening. Thank you for throwing a very good information on how health management students can play a better role in health system strengthening. Let us move on to the next speaker, Dr. Sumanth. Sumanth, I think when we were talking with Dr. Sudeep, he already brought out that there is a difference between community medicine and public health. But we would like to know in depth, because you are a community medicine person, and it would be great that if you throw some light on what is the difference between these two, and what is the importance of public health post-pandemic, right? If you can elaborate on this, I think that will be a great to know from your side.
Yeah, sure. Thank you. As he already said, there is a subtle difference, but definitely there is a difference between community medicine and public health. Both are not the same. According to me, community medicine is much broader area. Public health is part of the community medicine. If we see the levels of prevention, we say primary prevention, secondary prevention, and tertiary prevention. And we can do all these things at individual level, family level, and at community level. So if we take public health, it deals mainly with the community level activities, both primary, secondary, and tertiary level of prevention at a community level. Whereas community medicine involves these two, individual and family level also. That is exactly why community medicine is meant for basically a doctor who does prevention, all 3 levels of prevention at individual as well as family level. Whereas public health is open to everyone, because they did not know the minor things of management, case management, right? At the family level management, all those things. But at the community level, definitely they need to know. So it's a broader area, a nursing faculty or any other doctor, or even a non-doctor, non-health professional can enter, even engineer or a zoology degree. There are many universities which has kept it open for everyone, because they need not know this part. But if they know little bit of vague things on this individual and family level, that is enough. But their main focus is dealing with the community, all 3 levels of prevention, as I said, how to prevent certain things, certain diseases, or avoid smoking. So that becomes a primary prevention. Secondary, involving the supply chain management. All those things are kind of treating, looking at infrastructure as well as the material, everything. And also, if you are looking at disabilities at the community level. So all health related problems are looked at a community level and managed at the community level. So that forms the public health. Coming to your second part. Yeah. Coming to the second part of what is the role of public health in post-pandemic. I think public health is the health specialty, or I don't know, so subspecialty or super specialty, we can call it in any way, which is required every time, whether it's pre-pandemic or during pandemic or post-pandemic. It is the subject which is essential for everyone. So the importance will always be there. But if you have to specifically focus what is the need, then again it opens the Pandora box. There's so many things like surveillance, and all of us know what happened during pandemic, and know what all the lacunae, loopholes in health system were opened up. So we came to know what are the difficulties, what we lack. So all those things now can be identified and sealed in various mechanisms, as I said, manpower, material, information, health information. Every area of health, this can be sealed in, so that we know the immunization was hampered, NCD again that was hampered, the healthcare delivery, the drugs were not available. Not just COVID, every aspect of healthcare, mental health was also affected. So every aspect of health was affected. Now, in the post-pandemic, because we identified the weaknesses, now public health can seal all those weaknesses. So that would be the main area where it can work on. But it is like universal, and any time it is required. Public health is essential at any point of time in life. Only thing is trend changes. Maybe we need this today and tomorrow we may need something else. That's it. But it is essential anytime and every time.
So that means till human beings are there, there is a requirement for the managers to, meet the needs of the public health, right? To solve the
Only
issues or,
the
to
need
work
changes.
on. Yes.
Need changes. The type of need changes, but it is required.
Yes, like what we are talking about, earlier we were focusing on communicable diseases, right? Right
Exactly.
now, there is an increase in NCDs, and totally we require a different kind of people with a different skill sets to manage these NCDs. And the community level changes are much required here, and therefore I think health management people plays an important role in managing these
when we
kind of.
started thinking, okay, only NCD is required. Now we need both. Like
Yes.
with the onset of COVID, again we need both communicable and non-communicable, and again additional dimension of mental health, because that is itself is not sufficient, and it exposes the poor immunity and nutritional deficiencies, which can impact all of these. So how to manage this? So every area is important, and maybe the proportions keep changing, and maybe we can expect something all of a sudden new also. So that is where we have emerging and re-emerging diseases which keep coming. So yes, it is open, including health system. As I said, it has opened the weaknesses. So we need to seal those weaknesses, strengthen those weaknesses. So that is again that area. So it keeps changing. The trends keep changing. So we need to act accordingly. But it is essential every time. That's it.
Okay. Thank you, sir. Let us move on to our Guru Prasad. Welcome, Guru Prasad. Happy to see you here after so many years. I think I'm seeing you after 10 years almost. Guru Prasad,
Yes,
you have done a nursing, and I just was curious to know, after nursing, what made you to, because nursing is like you have to work with the people individual, in a close setup, like in a hospital. But whereas the public health is open up and you have to move around in the community, you have to travel a lot and so on. So what actually influenced you to pursue the master degree in public health and also to build your career in public health?
good evening, madam. Nice to see you after 10 years, madam. Madam, basically, I got into health sector is not by choice, madam. It is by chance only. My childhood dream was to become an engineer, but because of some financial issues, I joined nursing because I got it for free in government college. So, but I was not at all interested in the nursing field. But there was one course called community health nursing in nursing graduation. That course attracted me more because in that course we need to visit communities, and we used to do household surveys, group discussions, focus group discussions, interactions with the community. It attracted me more, madam, and the professor who was teaching that particular subject was influenced me more. So I was more interested in that community health only. So at that time, he guided me to opt your post graduation in that particular field, so the public health field, so that your future will be better. So after that, I joined. I was searching for a good colleges. I joined IIHMR, and in IIHMR, Dr. G.V. Nagaraj, he is a much more influencer, and he is an inspiration for me to get into public health also. Especially Femina madam, all those the professors like Vijay Vinay sir and Usha madam. Basically, this public health is, as you told, it is not like nursing that you are talking treating one patient, but public health is treating the community. So my family background, because I am from a rural background, I was my lifestyle is to interact with the people regarding various issues in the villages. So it was similar. My profession is also similar, that I was interacting with the community day by day with a public health cause. So because of this interest, only I joined public health, madam.
Okay, thank you, Guru. Let us go to the next questions. This is to Dr. Sudeep. Sir, you have been in public health and also you have some experience previously working in academic institutions. Let us know what fascinates students to take public health as a career.
Yeah, Dr. Sarla, as you indicated, yeah, I was in academics for roughly close to a decade period as a head of the department for a public health school. Primarily, because as I evolved from programs or field as Guru Prasad Swami has come, but later shifted to academics. Now I'm back into programs in UN. I was a bit interesting for the students to understand why I shifted from programs to research and academics again back to the programs. So what fascinates students is most of the time, as I indicated in my previous point, if you take me as a student, because as Guru Prasad said, he was not interested in nursing, he was interested in engineering. In fact, I also fall into the same group. I was interested in architecture, but I followed my elder brother. He was a doctor, so people are asking, he's a doctor, and you are fit to be a compounder in his clinic. So I kind of insults, that's the reason I chose medicine. Fortunately, I was good enough to score the medicine and get into the medicine. So even after starting practice after my medicine, I joined a PHC as a medical officer. After working for 4 or 5 years, I learned there are a lot to be done out of clinical medicine, because there are many doctors to serve. That I come from the coastal area, which is having better doctor population ratio than the country's average. I thought there are a lot of things to be done outside the hospitals or facilities. So that is the reason, primary inspiration for me to get out of the clinics and pursue my post-graduation in public health, then getting into the programs. That is how I took my career path. What fascinates students is how the program structure is, developed. For example, if something we are teaching which is totally out of their interest, then it is of no use. And also you can't keep just as their subject of interest, you can't teaching them, because it also should help in their career path. So it should be amalgamation of these two different things. One is the interest, what students should imbibe into that, and also that help the student into their career. If you take the present curriculum of public health or any health system management programs, I'm amazed to see some of the universities, including IIHMR, where they try to keep the subjects which are interesting to the students. For example, epidemiology, I was talking in the previous question, primarily to understand what is there in community, what is the disease profile, how it is being distributed across different populations, subgroups, gender, associations, if at all, different, distribution of diseases across different socioeconomic sectors, and so on. It is wide knowledge base to understand for the students. That is one thing. And other side, as I said, career opportunities. Anyway, that is a big topic to be discussed if it is required. But also students need to get exposed into multiple sectors within healthcare. For example, if we just keep teaching students within 4 walls, it won't help at all, and they lose interest. A field-based program, that is most important. That too, as I indicated, public health related programs, because government is a major public health sector. When we talk about public health sector, it is a government system, whatever we have, but it is not sole government system. We have various civil society organizations which are working in healthcare. We have various corporate system. We have various corporate social responsibility projects. Likewise, it is a diversified sector where we need to keep the students to get experience in every sector. It can be for a short period, 15 days, 1 month, that is because 2 years program is very short to learn. As Dr. Sumanth said, MD is a 3 years degree and public health is 2 years. They can't learn everything within 2 years, but practical exposure is most important. We need to give the students more of professional exposure rather than academic exposure. So when we give that interface, they will get more inclined towards, the public health management and get in. Apart from this, I would like to say, get a kind of internship exposures outside our state or country, wherever it is possible. Because when we talk about global health, it is not just healthcare within the state of Karnataka or whatever. We need to also, incorporate a component of global health management within this program. So this is a very comprehensive course where we need to teach them what is happening at the local level and also at the global level, kind of comprehensive knowledge and also comprehensive exposure in their career. These two streams have to go together to make them to get more interest into this course. I think most of the universities, including IIHMR, is doing that, and I congratulate for it.
Yeah. Thank you, sir, for your 2 points. To take away 2 points from here, I think if we have public health more focused towards field level experience, as well as you also teach them the global health, what is happening at the global level, and also we also have to focus on a practical where people get experience and then therefore they get interest. I think that was a great one, and I think IIHMR generally in the first year itself we take the students to the the field, we make them collect data, visit slums, visit PHC, and then give an exposure to them exactly what is public health. Thank you, sir. Let us move to the next question.
Dr. Sarla, I just wanted to add one more point.
Yes, sir.
Because this is the era of digital world. So another thing is, as you already have a course on technology, health technology related thing, I think that is another important component we need to add in the recent years. The health technology, technology in public health. That is another important sector.
Yes, M health. We are talking about M health, right?
M health is what we call mobile health, but in broadly, technology in healthcare, in public health, not in healthcare as such.
Yes, I understand. Yeah, there is a lot of opportunity for us to really explore and move towards that. Yes, sir. Let us move to the next speaker, Dr. Sumanth. It is related to what we were talking about, the career opportunities and so on. What are the skills required for a public health professional, and what are the career opportunities they can look for after completing the MPH course?
Okay. The core skills required. I think MPH needs, even for community medicine, we used to say like everything under the sun, right? Everything under the sun, including the sun, is a thing which you need to know, as well as the skills, all the skills to be a good human, including to be a good human being. So everything is required. But if you have to really summarize, I would say the epidemiology, biostatistics, which together form a biomedical research component, management, health management, communication skills, both oral as well as written communication, right? The oral communication is talking to people at different level, community and to the higher officials, as well as to present, that is written communication, and write reports. So those kind of communication skills are important. And leadership, as Dr. Sudeep was telling, leadership skill we need to develop. Of course, all these things will not come once as soon as you finish MPH course, but yeah, these are all like a lifelong learning, which we need to keep on adding some additional ammunitions in our basket. And again, advocacy skills, which is again has some component of communication and leadership. And again, some of the things like individual things like outbreak investigation. It all depends on the area where you want to work, technology, computer skills, like that. So the computer skills again is a very basic one. So which you need to add on the improvise on those things. So these are the basic things, skills anybody working in public health needs to develop. Coming to the opportunities after MPH, as again Dr. Sudeep was mentioning about NGOs who work in health and also development. Sometimes some of the NGOs purely work on development, but they closely related to public health. So again, health and development or health or development. Sometimes even the colleges, public health institute, where if they are interested in teaching, they can join them, and they can do the public health consultancy individual basis. If they don't want to join any institutions, they can be a public health consultant, like preparing the questionnaire, doing the survey, analyzing the problem, and suggesting the solution. So whole package they can take and be a public health consultants, or they can work as a team. Somebody who is experienced public health professional, and 2-3 the newcomers, they can join, work as a team in doing these public health consultancies. Statistical work, again, they can do those things. They can also be a clinical epidemiologist if you are very strong in the area of epidemiology and biostatistics. And of course, the projects, public health research. You can write your own grants based on your interest, and then do the projects where you can get your salary through that. Definitely through the organizations, yes, but that is one area where you can work, public health research. So these are the key areas where I think the opportunities are there post MPH.
Thank you, sir. I would like to ask, with related to this question, I would like to ask Dr. Sudeep. So what are the skills required to get into an UN organization or international NGOs? So you've been working in this, UN organization for so many years. So because many students, they are very much interested to work in, international agencies and MNCs and so on. That's what they come and ask us always. So what do you think? What skills are required for them to get into these kind of jobs?
Yeah, this is very interesting, but usually we think about when we were students, like during our public health post graduation, we used to talk about, hey, I want to join this UN. It looks very rosy from to get a job in UN, but it takes time. Immediately after we are post graduation, you can't. It is difficult to enter into a UN agency because the minimal requirement is at least 3 to 5 years of public health experience, primarily in government sector. That is what they expect. That is, I'm telling you the hidden truth. But usually when they call for any vacancies, that is what is required. At least 3 to 5 years of experience in public health system. That is one important requirement. So, in fact, I had worked almost 7 years at the primary health and secondary health level before my post graduation. So that was my strength to get easily into that. As Guru Prasad is working in Raichur within this health system program management, I think that kind of exposure primarily helps. So he's a good model we can take today. If he works for 3 to 5 years as a district program manager or a consultant, definitely it helps in taking his career further. So likewise, that is a good step for any public health or health management person to take the stream of UN jobs. That is one requirement. And second point is depends on your primary degree. See, there are various agencies. For example, if you take the health, if you talk about WHO and Unicef, all those things, of course, if you're a medical person, it is easy because it is a broader degree and it's a longer degree compared to other degrees, 5.5 years, close to that, 6 years. It's close to a post graduation if it is considering even undergraduate in terms of time period. It doesn't mean that it is other streams should get discouraged. For example, I worked for Nutrition International. That is a that was earlier known as Micronutrient Initiative. Primarily, it is a Canada-based international NGO which works on key micronutrients, primarily like iron, folic acid, iodine, zinc, and so on primarily focusing on women and children. It's a big agency across Africa and South Asia. I was reporting to a person who was a nurse, at country office as well as at the Ottawa region, the global office. The nurse and social work experts were my supervisors. I was working under them actually. I should not have a ego that I'm a doctor. Why I should report to a nurse? That diversity is there in such agency. Even in UN agency, yeah, in fact, currently I'm reporting to a doctor, but need not be. You can be, because it's a diversified agency. What I want to tell is, we have something called as competency-based assessment. It is not just your degree. It is not just your experience. As I said, some 3 to 5 years of experience in government sector. Of course, it helps. If you are from certain streams of preliminary education, degree in terms of preliminary discipline, medicine, nursing, or whatever, it also matters in certain jobs. And also something called as competency-based skills, for which there will be separate assessment, competency-based tests, what they do. Where there they usually assess your personality rather than your technical expertise. How you work in a diverse culture. How do you work being a representative from one religion? How do you work in another population which is of paradox religion, which is a different religion than yours? All these assessments are done and they assess your personality in such diverse themes. If you pass that, definitely you are in, otherwise it is difficult. And also, how do you communicate? And how do you respond when somebody is hostile to you, whether it is a subordinate or your superior? All these things are instantly asked or instantly assessed. You can't prepare for that. It is difficult to prepare in terms of your behavioral outcome. So it instantly comes, no, I will not agree for that. No, it actually hampers in terms of your selection. So these are the few things. One is your academics, one is your previous exposure, and other one is major thing is a competency-based assessment. That is a third important thing. And one thing I would like to add is when I said something, if you are from medical side, it is easy. It is not that. There are few areas where public health management from other streams are also preferred. For example, in nutrition, if it is a nutrition program, usually nursing background people are preferred. Because they are experts in being mostly, maybe most of the nurses I consider they are from other gender, female gender. Usually they prefer that to work in nutrition rather than medical people. So likewise, other sectors are also there. For example, Dr. Sumanth was telling about engineers. If you are an engineer and done your MPH or public health post-graduation, definitely there are scopes in projects like UNDP or even WHO, where technology-based health interventions are getting evolved across the globe. So it is not one degree, medical degree, which is always preferred. All degrees are in public health because everything is under the sun is public health, as Dr. Sumanth said. It is a nice term what he coined, because everything is public health. What I drink, what I eat, where I travel, roads, everything. A lot of things are public health, and every person is really contributing. So, irrespective of your previous qualification, the three important things are your exposure, previous experience, and how you build yourself as a professional, and how competent in terms of your skills and other competencies. I think this is in summary. Yeah.
Thank you so much, sir. Really, whenever our students ask me this question, I used to be speechless. I said, you will get it. But now I have an answer to say, that, you should have this, you have 3 years of experience, and then you can actually try for a new one. Thank you so much.
I think our course should also have a competency-based assessment at the end, to understand, how they respond to different situations. in health sector. That actually helps in getting into their career.
Yes, sir. Thank you so much. Thank you so much, sir. Let us move on to the next speaker, Guru Prasad. Guru Prasad, you have been working in government, with the government for so many years, and we want to understand what are the different opportunities available for public health professionals to get into a government organization or a government-related job. Okay, are there any specific skills which are required for our students to get into these kind of government sector?
Madam, there are a lot of job opportunities are there in government sector. When I joined Department of Health and Family Welfare in the 2012, at that time, as Sudeep sir told that for me, everybody was asking in directorate that who are you, what are you doing, what is your background, because they were known, the health department is known for only medical doctors and paramedical staff only. They never experienced like public health professionals, madam. So as I joined in 2013 in DH office Raichur, I am the only one consultant who has a background of public health, madam. But in nowadays, in recent days, we are 10 public health professionals working in DH office. I am telling, in one district we have 10 members, madam. For all national health programs, there should be one public health consultant or a program coordinator or a public health manager, madam. Because in these years, health department has seen only it is only administered by the medical graduates, but but doctors are more interested towards the treatment aspect. But there are nearly 15 national programs every day they need to work, but it is difficult for them to implement the programs at the field, madam. So in this point, we required public health professionals. So all the national health programs, while drafting their policy, only they are adding public health professionals as a like consultants or coordinators. We have got a lot of job opportunities in the government sector, madam. And recently, at PSC level, there is a one medical officer is there, and he is taking care of 30 to 50,000 population. He is handling too many national programs, so it is impossible for him to implement the national health program. So what government is planning, takes one public health manager at the PSC level, so that he can take care of public health aspect, and the medical officer who is sitting in the OPD can take care of the patients. So if it is implemented in the department, there will be thousands of job opportunities will be there in the department only, madam. And somebody was asking what are the job opportunities available in the government sector. I can say there are many consultants, like state level consultants, district level consultants, and program coordinators, program consultants, program managers. There are many job opportunities are there in the public health, madam, nowadays. After coming national non-communicable diseases programs, these job opportunities are more compared to earlier days, madam. And the skills you are asking, special skills, because but Dr. Sumanth sir has already covered the skills, and Sudeep sir also told the skills which are required for these professionals. Particularly for government, you should have a good communication skills, because public health, basically public health is not a, I should say, it is not a glamorous area. It is like you need to work in a high temperature. You need to work with the villagers. Those the education background of the community is very less. You can't expect good offices, good road, good transportation, everything. So you need to first, you should have a patience first, because you need to listen to every person who don't know anything, but he will order you to do that. So for me, in my 10 years experience, I have developed one good skill is say yes to first. Say yes. Okay, if you say yes first, then your 50% problem will be solved. Next, you do whatever you want to do, because they will accept you. Once you get the good results, they will accept you. But before that, you need to say yes in the government sector. Second important thing is language, madam, because if you are working in Karnataka, you should be fluent in Kannada. If you are working in Andhra Pradesh or Tamil Nadu, you should be you are familiar with the local language. It will be helpful, madam. And the third skill I am very much impressed is observation, madam. We should observe, because during COVID vaccination only, our district was a poor performing district, because nobody was ready to take vaccine first dose and second dose. So because there are many issues where in the community, because their culture is different, their behavior is different, their emotions are different. Okay, but if we observe them closely, we can understand their culture, we can understand their behavior, so that we can address their issues properly, madam. So observation skill is more important, and empathetically we should think about the community. We should not tell that you go and use medical big medical terms, they will not understand. See, go and sit with the people for 5 minutes to 10 minutes, observe their condition, observe their emotions, then you start interacting with them, so that they will listen to you. If they are listening, once they start listening to you, they will do whatever you will tell. And come to the what sir told, advocacy. See, you need to interact with many other departments, just like for example, in my program, fluorosis program, every day I need to talk to RDWS engineers and watermen, madam. At that time, I need to have some advocacy skills that will helpful for me to sanction RO plants to the place where the fluoride level is more. So we need to build our advocacy skills, and we need to build our language. We need to develop our observation skills. This will help us to survive in the government sector.
Okay. Thank you, Guru. To sum up, I think everybody is emphasizing on, you have to have the basic, communication skill. That's very important to work in this field. So you need listening, you have to observe, you have to be empathetic, and, you have to have other like, basic statistics and other interpersonal communication. You have to be, you also have to be a leader, to be in this public health. I think overall, if you really see, you have to have a passion to be in public health, right? If you have a passion to work with the community, I think you can actually understand the community and you can actually do something for the community. You need not to be always sitting in a clinic or in a hospital to really help the people, but there is a different field altogether. Come out and then be in the community and then help them out. I think maybe in the initial stage you have to be with the people, understand the people. But I think, as sir said, after 2 to 3 years down the line, I think you get a chance of being a manager where you can be in a UN organization, you can be in any kind of MNCs and other organization. And also one more thing which also he brought out is, Sudeep sir, is the role of public health managers in IT, right? Even the engineers have the opportunity to be in public health. So therefore it says that there is no restriction for which kind of people can, or which degree people can get into public health. I think public health is open to everybody, and it depends upon where you want to be, which field you want to be, and where you want to work. That's where the particular coursework is designed in such way which helps you to actually decide where you want to be, whether you want to be in maternal health, you want to be a manager, or you want to be a researcher, or you want to be a lecturer, or a professor in a college. That's where it depends upon you, right? So you have to decide what you are actually and what you can do well. Thank you all, and I think it's a time to take few questions, and I have a lot of questions in the chat box. Let me get into the one of the question. I think I can ask this question to Dr. Sudeep. Can you tell about the importance of public health in CSR?
Yeah, CSR, as you know, it is 2% of the profit of any corporate that has to be given to the social development programs. That is the CSR mandate as of now. So I will give an example. Reliance Industries, it is one of the largest corporate, which has the nearly annual profit is, I should not tell it, but anyway, it is in newspapers. So 30,000 crores is the annual profit for Reliance Industries, and 2% comes to around 700 to 800 crores per annum. Just imagine about this, 800 crores, it is almost one of the state's health budget, including NHM. If you include for a smaller state, I think it is a state budget, health budget. Now you can just compare how it is big, how big this CSR is. There are opportunities in terms of, because this 700 or 800 crores, Reliance has to spend on health, education, or empowerment of certain sectors which are lagged back in development. So there are jobs. They evolve some projects, health projects, where public health professionals are taken. In fact, I also worked as a chief of party for one of the leading CSR project in the country, primarily for the state of Maharashtra and Madhya Pradesh. This is primarily a consortium of Tata Industries. Is also equivalent to Reliance. In fact, it's also bigger than that in terms of certain sectors. It's a huge project. In terms of pay scale, also it goes to from starting with 8 to 10 lakhs to 35, 40 lakhs. That is the pay what they pay in terms of your seniority. So CSR is a huge thing because no corporates can escape from CSR projects because I'm sure government is still very vigilant on CSR spending as well nowadays. So this is the reason I think as the one who puts this question, thanks to you, so that I could share this on CSR opportunities. Yeah.
Thank you, sir. I think next question maybe Dr. Sumanth can take it up. The question is how to start public health career as a fresher and being non-medical graduate.
As already Mr. Guru Prasad said, the most easiest now entry level is like being a program coordinator in the government sector. Every program officer needs a program coordinator. There is a job opportunity. So you can enter there and then slowly build on your skills, because no amount of experience can be obtained just by a 2 years course. You can gain all these things during this initial work as a program coordinator. Then slowly you can move on, maybe as a program manager and other things. And or also there are many NGOs or MNCs doing individual researchers in institution, both academic and non-academic institution, doing some projects, research projects. There you can join. It is easy. Even in our project, we preferred MPH graduates or others, especially the nursing. Like in mental health, we preferred the people with the nursing background, MPH with nursing background. So they are used, or usually they can enter in those things in the initial phase. Then slowly, after one project and next project, they can move on to the higher level. So that's a best entry, either with the research projects or where again they have a multiple tasks. It's not just the research part. They have to look after the logistics, manpower management, so many things. They have to do a diverse work, and also in the as a program coordinator. So as he said, every district will have so many programs, and though the program manager is one, program officer is one, there will be multiple program coordinators for each of the subsections. So they need more people, and it is like dynamic. Some people, like those your seniors who have joined there, they'll move up, they'll go to next level, and so those posts will be vacant. So again, you can enter. So they're just dynamic. So you always have an opportunity.
Yeah, this question maybe Guru Prasad can take it up. What is the difference between Masters in Public Health and Healthcare Management?
Sorry, madam. 1 second.
What is the difference between Masters in Public Health and Masters in Healthcare Management?
Madam, the both are same, madam. Actually, I was also searching for the Masters in Hospital Administration. So after my completion of BSc Nursing, I have selected 3 different colleges for the admission, madam. One is IIHMR, it is PGDHM, and one is from in Manipal, that is MBA in Health Management, and another one is from Acharya College. It is Masters in Health Administration, MHA, Masters in Health, MHA. But after joining into IIHMR, I did a research on all these courses. The syllabus is same, madam. There is no much difference between the syllabus, course curriculum, everything, and the job opportunities also the same. See, they will ask you, not ask you particularly the designation like MBBS we want. No, they will ask you PG in public health or a post-graduation in health administration, health management. So like that they will ask. And any course with master degree in health management, they can opt the same job only. There is no much difference between all these things. Even there is a course called MBA in Health Management from Manipal. It is also same.
Yeah, just to add upon what Mr. Guru Prasad has said is, See, when we talk about Master in Public Health, when we talk about the healthcare management at IIHMR, what exactly we focus on is in the first year, you'll be doing all the management related course. We have HRM, human resource management, we have the OB, organization behavior, and so on. So some of the basic management skills are imparted in the first year, and in the second year, we specialize with the public health courses. So what happens is this not only helps them to get into not only into public health, but also later if they want to switch on their the sector, they want to get into IT, or they want to get into a hospital, or they want to get into consultancy and other sector in healthcare, there is a possibility of them to get into it because the first year already have imparted the basic management course to them. So that's the one advantage of taking up the the course at IIHMR. Yeah. So the last question, let us move to the last question of this webinar. This is to Dr. Sudeep. So what is the internship opportunity at Unicef?
Yeah, there are opportunities for internships in various agencies, including UN agencies. Unicef is one of the agencies. There are many UN agencies where even public health professionals are preferred to take. WHO, UNDP, then this one UNFPA, which is on family planning related and population control. There are many streams within UN, but I think if the question is specifically on UNICEF, if you go to the career page in UNICEF, there are opportunities for internships. There's a separate link. Usually there is no informal way of taking for UNICEF internships. It is always through the job portal. And if you go to the UNICEF career portal, there is a link called internships, where you have to update your profile, and also upload your CV, your statement of purpose. There are a few requirements to be submitted. I think it is depending on the preference, and usually they don't pay anything, and the person who is joining as intern has to take care of his subsistence and other expenses. But there are opportunities. And apart from UNICEF, there are other NGOs. As I said, for example, Nutrition International, which is also a big agency having a lot of corpus in terms of funding. They also have internship opportunities. So every website has a link for internships. You can just Google for internships in public health agencies, and it will take you to some link to the ports. So with respect to UNICEF, this is the way how you can be an intern. For 3 months, minimum 3 months is an internship in the United Nations Children's Fund. So there is no informal way of joining the internships in like how you can, for example, if you join as an intern in government, it is easy because you just have to approach some state directorate, and if it is required, they will take. But in UNICEF, usually it is a formal process. Yeah. But there are opportunities. Sir. If you are definitely competent, you will get it.
Thank you, sir, for your response. We have so many other questions, but due to shortage of time, I think we should be able to help you out. Our admission team will certainly address each and every questions. You can contact our admission team, and there is also feedback form. I now request Dr. Deepashri to give vote of thanks.
Dr. Sarla, I just want to add one point in the career.
Yes, sir.
Those with MPH can do after working in 2-3 years in some projects or the office, they can also apply for PhD in the reputed universities if they want to pursue the research, as well as once they finish PhD, their rank goes up, then their entry into the UNICEF or UN or any other organization becomes much more easier. So because that PhD gives a lot of experience. So that is another opportunity.
Yes, sir. Thank you, sir. Dr. Deepashri?
Yes, ma'am.
Yeah, please go ahead.
Yeah. Thank you, everyone from research, academics, experience, national, international, government. I think all our participants got an overview of what is public health, what is community medicine, and job opportunity skills. And this information was a need of our. And thank you from all my panel members, Dr. Sudeep Shetty, Dr. Sumanth, and Mr. Guru Prasad Swami, and wonderfully moderated by Dr. Sarla. Thank you so much. and requesting participants to fill the feedback link for us so that we can bring you similar kind of interesting webinars to you and get an information, practical knowledge, and experience, a field level experience from well established panel members. Thank you so much, one and all, and thank you, ma'am.
Thank you, sir. Thank you, Dr. Sumanth. Thank you, Guru Prasad. Dr.
Thank you, madam.
Thank you.
Yes, sir. Thank you, sir. It was a nice, pleasant webinar. Thank you.